Thank you. Our other co-chair, Kaliska Day, we're going to be splitting facilitation for this meeting, and I'm going to cover the first half and Kaliska's going to cover the second half. So this is the meeting of the Portland Utility Board, and we are meeting under Portland City Code and state law. We're holding this meeting electronically. Board members and relevant city staff are attending remotely, electronically, or by phone, and the city has made it available to the public to listen to the audio broadcast of this meeting. The meeting is indeed being recorded. The public will have an opportunity to provide comments during the public comment portion of the agenda and can also provide written testimony by emailing the board at utilityboard@portlandoregon.gov. PUB believes and acts upon anti-racist principles in our meeting spaces and interactions within PUB. While every person has the right to share their personal perspective, we stand against wrongful conduct, particularly any conduct that's targeted toward people that are made vulnerable by systemic inequities. What this means is stepping up as a community when there's wrongful conduct and fostering a space of learning and growth. We speak up and speak out. Each person, each one of us on the board is empowered to maintain the culture of the Portland Utility Board, and we focus on the impacted individual or population, condemning the conduct but not the person.
Hi, my name's Amy, and I will quickly run through the meeting guidelines. Please state your name before you speak, and if appropriate, state the name of the person you're addressing or that you're addressing the group. The chat box is only viewable by the hosts, which is the PUB staff, Eliza and myself. Please limit to technical and logistical issues, including signing up for public comment, to ask for technical assistance, or to remind us that you have been waiting to speak if you've not been called on. The raise hand function is primarily used by the board. The co-host may lower your hand once you've been called on, just to maintain the flow of the conversation. During public comment periods, the public can raise your hand and you'll be called on when appropriate. If connecting by phone, please press *9 to raise your hand. Videos may be turned on for the board presenters and facilitators when speaking. If desired, it's not required. Others should leave their videos off. Please mute your microphone when speaking. Members of the public will be muted except when giving public comment. If you're connecting by phone, please press *6 to mute or unmute yourself. Public comment will be taken during the comment period early in the meeting. You can sign up through chat with PUB staff or raise your hand during the public comment period. It's also available just prior to any formal board vote after a motion has been made and seconded by board members. As mentioned, this meeting is being recorded. Back to you, Karen.
Thanks a ton, Amy. So we will start with our usual hellos to everyone. Hello. And disclosure of communications, if any. We'll then hold our public comment period and review our minutes from, I believe, our May 3rd meeting. And then the first business item that we'll be talking about today is will be coming from board member Julia DeGraw and ex officio board member Sarah Messier with a presentation on the lead hazard reduction program funding, and also the memo and recommendations that Julia has been working on over the past several months. We'll then take a break and move on to finishing up our recommendations on the financial assistance program, billing, and debt recovery that we've been working steadily through the last couple of meetings. And Kaliska, as I mentioned, Kaliska Day will be facilitating that part of the meeting.
And sorry,
oh my gosh, and I hope we adjourn before 5 o'clock.
Yeah, I was just gonna say, I hope we're still at 12:30.
Yeah, we will be adjourning at 12:30 now, 5 o'clock. Does anyone have any disclosures of communications with city officials that they would like to disclose?
And Karen Spencer.
Oh, sorry, didn't see Karen's hand. Thanks.
Hi, yes, Teresa Wong and I met last week with equity managers for the city as part of our workforce development team. And we are looking forward to being able to provide our report to the full pub as early as next week.
Fantastic. Thank you, Karen Spencer. Sorry, of course, the lawnmower is going off in my neighborhood. Okay, I don't see any other hands for disclosures. So let's move on to our review of May 3rd minutes, as well as the subcommittee April 28th minutes. Are there any corrections or additions or omissions you noted in those two sets of minutes? Not seeing anyone wanting to get our attention and make corrections. Those minutes will be adopted as written and presented. Thanks, Eliza, for compiling those. All right, we are now at the public comment portion of our meeting. And Amy, Eliza, could you please let me know if there is anyone that would like to make public comment?
We do have one person signed up so far. Dee White is the first person signed up.
All right, Dee, please go ahead.
Okay, can y'all hear me? I unmuted.
Yes,
Can you hear me? Okay, great. I gave this testimony yesterday at the City Council budget and rate hearing that the Water Bureau and BES had. And in the past, PUB and the CUB have both given testimony ahead of the hearing, and it's disappointing that y'all weren't there yesterday. I don't know why the Water Bureau has decided to rearrange that and exclude y'all. But anyway, so here goes. Hello, my name is Dee White, and I'm speaking on behalf of Portland Advocates for Lead-Free Drinking Water. Today, I'd like to ask Commissioner Mapps and Water Bureau Director Salmer, why is a comprehensive free water filters program not in this budget? In November, testing showed Portland's lead levels were the highest they had been in 2 decades. Example, Seattle lead testing results were 2 parts per billion, and Portland's 21 parts per billion. Again, this happened in November, 2 months before the Water Bureau started working on their eye-popping budget proposal and their ongoing regressive rate increase. Why aren't the vulnerable being protected? At the very least, Portland's vulnerable, including pregnant women, babies, children, low income, should be getting free filters until the Water Bureau does its job and drastically minimizes lead at everyone's taps. According to the EPA, we now know that 80 to 90% of an infant's lead exposure can come from drinking water, and measurable health impacts are found ingesting water with lead levels averaging 3 to 5 parts per billion for children in general. Again, in November, the Water Bureau rang in at 21 parts per billion. It is outrageous that filters are not being widely distributed throughout the city, as we also know that the Water Bureau's lead crisis is system-wide throughout the city. Newark, Pittsburgh, Chicago, and Denver all have a free filters program going on as I speak, while they are implementing treatment and replacing pipes. What's wrong with Portland? How can this not be happening here? So again, today, I'd like to ask Commissioner Mapps and Water Bureau Director Salmer these very important and urgent questions. Why isn't a comprehensive free water filter program in this budget? And why wasn't a free water filter program implemented and decimated immediately after this acute lead problem presented itself in November? Thank you.
Thank you, Dee White, for your testimony. I do want to state for the record that Pub was not in any way excluded from participating in the rate hearing. But again, I just want to make sure that's clear for the record. All right, we will move on. And indeed, the topic of this testimony
Karen, this
is indeed
Sorry,
the
Karen,
top. Yes.
Sorry, I wanted to jump in and just, this is Robin, one of the voting members. I'm seeing that we were invited, but decided that what we had already offered was sufficient. And I'm kind of realizing now that I think Dee made a good point, which is that even if we thought it was sufficient of our input, it kind of feels like the rate hearing is really central to the work that we do. And so we may want to think going forward that even if we've submitted enough information, that it might be important that we are present and represented in person at those meetings because of how relevant it is to our work. So I just wanted to state that.
Thanks, Robin. Yes, and we did have the opportunity to show up as individual Pub members. I hear your point loud and clear. And we had that option available. Any of us certainly could have shown up.
Karen,
Tom, please go ahead.
Thank you. I just want to say I agree with what Robin just said, but I also wanted to ask Karen, do you have any other clarifications to Dee White's testimony that you would that you heard? I heard some things that I thought, for instance, she said that the Water Bureau is not giving out filters, and I thought that Sarah clarified this at our last meeting, that the Water Bureau is giving out filters and they have a process for doing that. So anyway, I'll just make that comment that it seems, and maybe Sarah or somebody from Water Bureau can, when we get into the discussion about lead, can bring that up, and anything else that might clarify anything that Dee just presented to us, if needed. Thank you.
Okay, thank you. Thank you very much, Tom. And yes, in fact, we are, as I mentioned, we are going to be talking about that very topic in the next section of our meeting. But thank you, Tom, for that clarification. All right. So if there is no further public comment, then we are moving on to indeed the Sarah Messier's presentation on the lead hazard reduction program, and we'll listen to this and then we'll have our deliberation on the memo that Julia put together. So Sarah, please go ahead.
Hey everyone. So I am Sarah Messier, ex officio member on Pub for Portland Water Bureau. And I'm also the lead hazard reduction program coordinator. So everything that I'm talking about today is my day-to-day job. And I'm really excited to tell you about this program. And I'm just giving you background information and then handing it over to Julia to talk about her recommendations and things like that. So I'm just sort of setting the stage for all of us. And I'm very lucky to have Amy as my technical assistant. So Amy, if you could go to the next slide. Okay, one more. So starting with the background of the lead hazard reduction program. So next slide, Amy. So first, I'm just going to talk about lead in Portland and specifically lead in homes. So two places that are that have lead in homes are paint and in plumbing. So the picture of the window on the left may be familiar to some of you. I've definitely seen it in my rental homes when I was a renter. But we commonly see paint, homes built before 1950 have lead paint and are at high risk for lead exposure from lead paint and dust. And windows like this are particularly problematic because the friction really creates a lot of dust. And when we have young kids in the home and they put their little paws on those windowsills, and then they, put that right in their mouth. They're just directly ingesting lead paint and lead dust. Another source of lead in homes is in our home plumbing systems. So we are fortunate here in Portland that we never used lead service lines like we hear about from Flint and Newark and Denver and Chicago. All of those cities have lead service lines. So that's the pipe that runs between the water main that runs underneath the street into the house, the building. So in Portland, where we find lead in plumbing is actually in lead solder that's used to connect copper plumbing. And that was most commonly used between 1970 and 1985. And we also have faucets and fixtures that have leaded brass in them. And that was in 2014 is when rules changed around leaded brass. So, so really we're looking at, when we're talking about lead and water in Portland, we're really looking at homes that were built between 1970 and 1985 that are at highest risk for having elevated levels of lead in their water from their home plumbing. So the next slide, please. So this is a map of the city, and I just want to orient, or the region, I should say. I just want to orient you to it. The website is, URL is located at the bottom. It's interactive, so I really like looking at it. So if you want to get a better look at it, you can check it out online. So the legend's really small, but let me first orient you to it. So you see the Willamette River is the black going through the middle of the city. You can sort of see 205, and then you can see 26 moving out there. So when we're looking at the city, the cooler colors, so the blues are built in the either late 1800s to mid 1900s. Homes built or buildings built 1950 are in purple. And then the pinks to whites are the later half of the 1900s into 2000s. So the really like cool blue colors were built before 1950 and are at highest risk for lead paint. And then we're looking at for homes are at highest risk for lead and water based on their home plumbing. So that's 70 to 85. We're looking at more of those pinks. So we can see like really the inner core, especially, inner Northeast and North Portland are at highest risk for having lead paint. That's really where our older housing stock is. And then as homes were built and expanded and the metro area was expanded, we see these, the newer homes in that pink sort of, outer east, and then especially down in Southwest and as we move out into Beaverton. So I'm going to get ahead of myself a little bit here, but since we have the map, our lead hazard reduction program was created in the late 1990s, and we focused our that program initially on inner North and Northeast because of the homes and because of the demographics of the folks that were living in those homes. Obviously, with gentrification, the demographics of folks that are living in inner Northeast and North Portland has changed. So I just want to have that in the back of our minds as I keep talking about our program. So next slide. So we work closely with the Multnomah County Health Department, and they investigate all elevated blood lead level cases that come across their desk. So when a kiddo is tested, when their blood is tested for lead, there's a law in place that all those results have to be reported. So that's sent to a database that the state and counties can access. And when there is an elevated blood lead level case, here in Multnomah County, we have a risk investigator that goes out or interacts with the families, goes out to the homes, tries to identify the source of that lead exposure so that they can either remove that from the home or reduce that lead exposure and work with the families one-on-one to bring those lead levels down in those kiddos. So their investigations can include testing the paint, testing the dust, testing objects, and testing water for lead. So this graph shows the results of those investigations from January 2013 to just to the middle of May. So you can see the majority of the cases, or a large chunk of the cases, 42%, are from lead, paint, and dust. Country of origin is about a little over a quarter of sources. So when refugees come into Oregon to resettle, part of their standard health screening is testing their blood for lead. And so a lot of folks, a lot of kiddos are coming in from Afghanistan and from Southeast Asian countries. They're coming in with those elevated blood levels. So the county works with those folks to help. So the source is from the country they came from and not from here in the US. And so then we have a group that were not identified by the investigation. And then we have some smaller percentage of cases. The font's a little small, but includes like antiques and toys, either traditional or culturally specific, medicine or cosmetics, ceramics and pottery. And then we have a group of other, which can include travel, multiple sources, occupational, where the parents' occupation, they get covered in lead dust and they bring it home, sinkers and shots, soil, hobby, imported or traditional foods, and other objects. So one thing you'll see that's not on this list is water. So the county has not found a case where water is found to be a significant or primary contributing factor to that elevated blood level case. So next slide, please. So now I'm going to start a little bit on the history lesson here. So this is part one of how we created the lead hazard reduction program and what it is. So in 1992, EPA enacted the lead and copper rule. And so that's required all drinking water providers to test their water for lead. And if they had high lead levels, then we would have to install drinking water treatment to reduce that lead. Prior to this, no drinking water, treating the water to reduce lead levels was just not a thing that water providers did. So after that was enacted in the early 1990s, Water Bureau did some research and experiments to determine what our water treatment options were. We did that initial testing. We found we had high lead levels, so we knew that we would have to install drinking water treatment. So in 1994, Water Bureau went to City Council and based on the research and experiments, the study that we did, said, okay, this is the recommendation that we start water treatment, and the study tells us that we have to change our water chemistry, change the pH and alkalinity to reduce lead levels. So at that time, City Council directed Water Bureau to investigate alternatives to the recommended drinking water treatment. So between 1994 and 1997, Water Bureau, we started constructing our water treatment facility. And we also worked with our public health agencies, both at the state and county level, to develop an alternative program. So in 1997, we went back to City Council and said, okay, we came up with this alternative program called the Lead Hazard Reduction Program. And it's comprehensive. So it's not just addressing lead and water. It's as we saw in our past pie chart, the largest source of exposure is from lead paint. So if we're going to spend money on reducing lead exposure in the city, how about we spend some money on addressing the drinking water? And then how about we spend some money on addressing paint and other sources? So we proposed that to our state regulators. They approved it as it's called optimized corrosion control treatment. So this tells us that we are complying with the EPA's lead and copper rule with this lead hazard reduction program. So since 1997, we have been meeting the lead and copper rule requirements with the lead hazard reduction program, and we have been treating the water to reduce lead by just increasing the pH. So remember, the recommended change was addressing pH and alkalinity, and we did partial treatment by just addressing pH. And then the money savings from just doing this partial treatment, we used and applied to the rest of the LHRP to address all sources of lead, including paint in our region. So next slide, please. So the lead hazard reduction program is 4 parts. So we have 2 parts that address all sources of lead, and we have 2 parts that address lead in water. So I'm going to be talking about the 2 parts that address all sources of lead. So we have a public education community outreach grant program, and then we also partner with the Housing Bureau. They administer a lead paint removal program. The 2 components that address lead and water is our drinking water treatment, adjusting the pH, and our monitoring, where we test the water from a little over 100 homes every 6 months to see how that treatment is working. And then we also have a water education and testing program where we do outreach about our free testing program for all residents and provide that free lead and water testing. And that's the program that is also now providing filters to folks that have elevated levels of lead. So next slide. Okay, so I'm going to dive in a little bit, the next 2 slides on these 2 components that address lead of all sources. So our public education and community outreach program is a grant program that funds community partners to do all sorts of education, outreach, testing, and remediation work throughout the region to address all sources of lead. So the list of our current community partners are here. So we work with Community Alliance of Tenants, Community Energy Project, Growing Gardens, Multnomah County Health Department, and Portland Public Schools. And then we also do landlord outreach mailing every year. So these community partners do all sorts of activities, including home investigations. They have hotlines, do workshops, table at community events, do blood level testing. PPS does paint stabilization in areas where kids 6 and younger are. Growing Gardens does soil lead level testing. And historically, we don't do this anymore, but we funded parks as well, and they did some playground equipment replacement. So all these folks are embedded in communities. They do a lot of culturally specific work, and they partner with culturally specific groups too. And they've done a really, I'm just like, as their grant manager, I'm very proud of the work that they do in making sure that they are reaching, not just the average Portlander, but making sure that they're reaching folks that have historically been excluded from or not know about other city services. So the total program cost, just so to keep this in mind for future decision making, is $425,000. So our annual grant program is $395,000 every year, and then about a quarter of an FTE or $30,000 for staff time to administer the program. Next slide, please. So we also partner, as I mentioned, with the Portland Housing Bureau, and they lead a lead paint removal program. So they receive federal funding from the U.S. Department of Housing and Urban Development, or HUD. And so this funding is used to address lead paint hazards in homes. So eligible homes must have lead paint and have a low income family with a kid under 5. And homes is both single family homes and apartments. The lead hazard reduction program, our grant program that I was just talking about, so that funding for the grant program is required match funding for this HUD grant. So if we don't have the grant, the LHRP grant program, then Housing Bureau will have to either find some pocket of money to use as that match funding, or they will not be able to get these free federal dollars to remove lead paint from homes. So the table here shows you how many grants they've gotten over the years. So they're 3-year grants. They get about $3 million for each 3-year grant, plus or minus, depending on the year. And you can see how many homes or apartments they've completed during those times, and the number of kiddos that whose living situations have been improved through this program. So next slide. So jumping back to our history lesson here. So part 2. So as a reminder, since 1997, we've been meeting the EPA's lead and copper rule requirements with our lead hazard reduction program, and we've been treating the water to reduce lead by increasing the pH. So in 2013, jumping ahead a bit, we were doing our routine water testing. As I mentioned, we do this testing every 6 months, and we found elevated levels of lead. So it had been a while since we had studied and researched lead in drinking water in our system. So we want to see if there's anything new going on. So we began a new study, new research, and looking at lead in our drinking water system. So in 2014, also this is something that is sort of background information, the Anderson lawsuit happened, and the settlement said that Water Bureau expenditures must be reasonably related to the provision of water. So because the lead hazard, even though the lead hazard reduction program addresses both water and paint, because it is our compliance program for the lead and copper rule, we are able to spend money on addressing all sources of lead. But that's going to be changing fairly soon. So in 2016, once again, we are doing our routine monitoring in homes, that every 6 months monitoring, and we found elevated levels of lead again. So Water Bureau, we agreed with our state regulators to install improved water treatment to further reduce levels of lead in water. So from 2016 to 2022, Water Bureau, we designed and constructed an improved water treatment facility and to address both pH and alkalinity. So we're going back to, we redid the study that we did in the 90s, and we reconfirmed, okay, to fully address lead in water through drinking water treatment, we have to increase both the pH and the alkalinity. So this year, we began our improved treatment on April 20th, 2022. And our state regulator notified us that the lead hazard reduction program is no longer required once our improved treatment is proven to be effective. So at that point is when because of the Anderson lawsuit, we would not be able to spend ratepayer money on lead paint. We'd only be able to use those funds related to the provision of water and treatment of water. Next slide. I think, that was my last slide. So now I will, unless there's any questions, I'm happy to answer any questions. I'll be handing it over to Julia.
Actually, Sarah Messier, this is Karen Williams. Can I ask just one question before we move on to
Please.
Julia? And that is, would you clarify for us why alkalinity is important, what that does?
Yes, I'd be happy to. I will also say I have not taken a chemistry class in a very, very long time, but so right now we have increased pH and our main source of drinking water is the Bull Run watershed, and that source of water is naturally low in alkalinity. So our pH, we can increase our pH, but it's still, alkalinity provides a stabilizing sort of force on pH. So we can increase our pH right now, but it can sort of move up and down, and we track it all over the city. And when our water sits like in pipes for a long period of time, we can actually see like a big drop in pH the longer it sits. So so when you add that alkalinity, that drop overnight, like say your water sitting in your pipes overnight, that drop isn't as great. So it really just like stabilizes the pH around the city and then also within plumbing systems.
Thank you, Sarah. It looks like we have a question from Tom.
Yeah, hi, this is Tom Lipton. I wanted to ask Sarah, what is the expected time frame for the confirmation that the new plant is working? And then also with the discontinuation of the program, because we're doing the treatment, does that mean that lead testing for homes and apartments will go away? Or does that remain as a part of the Water Bureau's stuff?
Yeah, great question. I actually had a meeting right before this where we were discussing the second half of your question. So the first part was how long are we going to know before we know that it's working? So we're actually in the middle of, so they're sort of ramping up this new treatment in steps so that we don't shock our system. And we're sort of just allowing our pipes and everything else to acclimate. So we are doing that in steps over 3 months. So we turned it on April 20th, and we're coming up next week. We're going to do our second step. And then end of June, we're going to do our third step. And then that's our last step before we're going to let it acclimate. So we're going to learn more throughout the summer and of how it's working. We have many programs and places where we're actually testing water. Like I'm testing water in my home. We have many programs that are looking at all different types of things. So we're hoping to have more information towards the end of the summer, in the fall. And we're already, I know my team would love to come back here sometime, maybe in the winter or so, to give an update on what we're seeing with our new treatment. So for the second half of your question, are we going to be providing free lead testing for our residents after we turn on treatment? Yes, we will. We've been doing free lead testing for our customers since like the 70s or 80s. So it's something that we've done sort of as a standard service, and it's just a really great tool for our customers to learn more about their plumbing system. So yes, I anticipate that we will continue that free program. It'll just be much reduced. Yeah. Kayla, I see a question from you.
Yeah, thank you. I have a question regarding the grants that we have where I think we're spending like 106,000 or something like that on community energy projects.
Yeah.
Can you tell me a little bit more about the community energy project and like the likely recipients or folks that are receiving those grants?
Yeah. Hey, Amy, do you mind going back to that slide with the grants? Forward one. Yes. Oh, that's one. Perfect. Thank you. Yeah, so Community Energy Project, they've been one of our, they're one of our original grantees. We've been funding them. I forget if it was the late 90s or early 2000s, but they're one of our original programs that we've been funding. So they provide 2 different types of workshops about, they have a lead safe lead poisoning prevention workshop that just goes into all sources of lead and how to clean up lead dust and how to live in a home safely that has lead paint. And they also have another workshop, Lead Safe Home Project. So say you have an antique piece of furniture that you want to repaint or refinish, like how to set up your space so that you can do that work in a safe way. They've been partnering most recently with WIC clinics and breastfeeding support groups. So really getting to families with young children and have been expanding their language access. A lot of their workshops, they present with an interpreter. So they are really, have really expanded into multilingual communities over the past, I would say, like 5 to 8 years. They also do tabling and they have a HEPA vacuum, which is a vacuum that has a special filter so that you can vacuum up lead, potentially, or dust and paint chips and things like that, that has a potential for including lead in it. And the filter makes sure that that dust isn't just respouted out around the room as you're doing that vacuuming. So that's a little bit about what Community Energy Project does.
So yeah, part of the reason why I'm asking, when there's a competition for resources, where does it convert? Where does the lead paint go from having lead out of our water? And I'm kind of thinking, is a strategy focused on, is a strategy keeping lead out of our areas or grass so it doesn't get into our stormwater and getting into our water? Is there any because is that kind of part of the strategy with that, as far as getting lead out of our water?
So these, I'm not quite sure.
Or is it just focused on safety?
I would like to jump in real quick. Are you, I think that it sounds like you are concerned that lead is somehow actually getting into the drinking water source. And I don't, is that what you're?
Oh, no, I'm sorry. So let me try that again. What I am thinking is, being that the Water Bureau is really focused on getting lead out of the waters, and with the limited resources or competing resources, should we focus more on getting lead out of the water as opposed to just educating about lead that is not in the water?
So I feel like I followed you up to a point. So these grantees right here, as I mentioned, they're focused on lead of all sources, but primarily paint. Growing Gardens focuses on lead soil or soil, lead that could be in soil. So these grants are not tied to lead that could be added to our drinking water from home plumbing systems.
Okay, yeah, that's what I was trying to decipher is, did we find that lead from our soils, from the air or something is getting into our waters? Is that why we're making investments in them? Because I realize that there's a lot of needed resources that the Water Bureau needs to clean lead out of our water systems and just want to get a sense of, where we should be allocating funds.
Yeah, so going back a few slides from here, so it's not that we're cleaning lead out of our water. Like our water isn't like dirty with lead from like the Bull Run watershed or our groundwater source. So lead enters drinking water in home or building plumbing that has lead in it. So either that, as I was saying, that lead solder that is used in plumbing systems, most commonly built in homes built or plumbed between 70 and 85, and brass fixtures that were installed up until 2014. So
Okay.
we're building that treatment plant so that the treatment plant reduces the corrosivity of our water. And so the water will not corrode the metals and add that metal, the lead, into the drinking water from the plumbing systems. Yeah, Julie.
Okay.
I think there's one other slide that I think was really helpful with your question to Kale, and that is when she spoke about the number of cases of elevated lead and blood levels in the Portland area. They haven't found a case where the main cause of that was exposure to lead from drinking water. And so we have this program that's funded because of elevated levels of lead in drinking water that allows us to try to address exposure to lead from all sources. And I think it's really the reason why there's so much resources going into helping community members deal with lead from other sources is because that is where they are getting contaminated. That's where the elevated blood levels are coming from. So I do feel like the program is actually putting the limited resources they have toward actually reducing, the exposures to lead where people are actually getting them. And once we have the data, this corrosion control could really be reducing the amount of lead that's leaching into people's drinking water significantly. But I think that's and we're going to your question also kind of ekes over into like my presentation, which is about the recommendations about how we should move forward, given kind of these realities. But have we kind of answered your question?
No, you answered my question. My question is really that, like, if we are saying we need more money invested in our filtration systems, and into water management, why are we continuing to invest? And it's not that I don't think it's important. I think that maybe that program should take ownership, from a different department or something like that, because we are more focused on water. And if it runs into capacity issues, maybe that's something that should be considered is, maybe somebody should take ownership of this project other than the water bill, so that the capacity is all focused on water.
That will definitely be part of the recommendations. Our recommendations are broader, but the reason why we have why we get to make this recommendation about a broader issue is because the nature of this program is about all of lead, even though it was created because of lead found in drinking water. So the recommendations kind of address what you're talking about there. We're going to be making recommendations to council, if we all agree to it, that will hopefully expand the program to not just be a Water Bureau program. But we'll cross that bridge when we get there. I see that Tom has a question.
Oh, thanks. So along these lines, and we can get into this more, but at this point, I thought it might be interesting to bring up. So as Sarah was mentioning, it's the houses or the buildings that actually have lead in the plumbing. And it's because our water is, I guess you might, for a simple way to put it, is kind of pure. So it facilitates that lead comes out of the pipes into the water and then gets into whatever somebody's using the water for. So if we're looking at that Anderson lawsuit and that provision that says reasonably related to water, some people, maybe we might discuss this, could decide, well, the water's good. It's the city and the state that allowed lead to be used in pipes back in the days when this was done. And so the water's good. It's the house and the plumbing that's bad. So why should, one might ask, why should Water Bureau pay anything when maybe the building department or whoever takes care of that type of thing, maybe they should be responsible, as in the case of the county and the Portland Housing Group, where they are looking at spending money to help with lead paint, because they're associated with that, I guess. But anyway, I'm just trying to say, if you look at it and you take it more literally, it seems that the Water Bureau actually, as it relates to this particular issue, it seems that perhaps they may not have any responsibility. Unless you say, well, your water's so good that it makes our bad pipes, makes our 10% of the homes in Portland a hazard. I mean, that is how we've been looking at it, right? But it seems there are others who could look at it in a different way. So anyway, just wanted to bring that up.
Yeah, I just want to jump in and just say that we still have to comply with EPA's lead and copper rule. And that is based on collecting water from homes that have confirmed lead solder in their plumbing. So I definitely hear you. And I mean, this is a big debate. And, you know, the Water Bureau is required to test for water from homes that have lead solder. And if elevated levels of lead in water are found in those homes, then we have to, we're required by the EPA to install treatment.
I think that's what needs to be made very clear, is that even though the exposure is happening outside of the Portland Water Bureau system, the Portland Water Bureau legally is responsible for, you know, that exposure. That's how it's been framed up. But that's why we're doing the lead hazard reduction program, is to comply with that rule and reduce that exposure, even though it's happening in people's homes. But today we're going to be discussing broader recommendations around the fact that because we are addressing that lead exposure in drinking water, this program is going to go away. And we're going to lose all this resource that currently exists for addressing lead in paint. And you saw the number of children that have been helped by this program, right? So that's kind of what my presentation is more about, is getting at these recommendations this is an issue that is near and dear to my heart. I've been worried about, I came to this a while ago when I was working at Food and Water Watch, and discovered that folks were being exposed to lead and that there was this corrosion control project that needed to come online. And I got really passionate about, trying to create a program that would get lead exposure from drinking water down to zero by helping people replace their pipes. And it's through my work here at the pub that I learned that exposure or elevated blood levels of lead from water is kind of unheard of, but that there's a lot of lead issues happening with paint and from other sources. And so, and I also learned that this program that exists because of the Water Bureau and through the Water Bureau is actually being used to address all sources of lead in the home. Really helped me kind of shift my personal perspective on how we should be talking about this lead program. So if we can move to the next slide. Yeah. So I just wanted to give a little bit of additional context. I'm not going to walk through the whole memo. I'm really trusting that all of you did read the memo. And we just had that really great presentation that offered us a lot of background. So thank you so much for that, Sarah. But I did want to say, we're going to be shifting soon to the next slides, which we're going to have the actual recommendations on them. But I just want to say up front, if you've read through the memo, that if you feel like the first and second recommendations are similar, your instincts are right. Basically, the first recommendation is kind of like the baseline level that I think we should be asking for, which is that the city continue to fund this program at its existing funding levels, so at least it doesn't go away, and we can continue to compete for matching funds from the federal government to provide really important services to Portland community members to help them reduce their exposure to lead. And the second recommendation is kind of building on that and urging the city to partner with other, to make this not just a water bureau program, right? To have them expand the program across bureaus and with the county, to hopefully expand their resources, get more funding for this work, expand the geographic area that we're actually accessing and helping people out, and hopefully get a more comprehensive, better funded program that will actually get lead exposure in our city down to zero, and whether this is, creating a low to no interest grant program for replacing lead pipes in low income homes, or helping reduce exposure to lead through lead paint. That's really that second recommendation is really urging the city to look at how do we start addressing this problem more holistically and systemically, and in partnership with other jurisdictions and bureaus that this makes sense for this to be under. So it's no longer this strange, like, water bureau only program when you're trying to address all sources of lead, right? So that's what the second recommendation is. It's really an expansion of, is a request that the city look at really expanding this program and partnering with other jurisdictions to increase resources, frankly. I wanted to also add a little additional context in terms of the timing of this recommendation. We have basically a year, and Sarah, correct me if I'm wrong, for the results of the program to be proven out. And if we're compliant with the EPA on reducing lead exposure for drinking water, then we will no longer have funding for this program. So if we are making this recommendation, if we are going to City Council with these recommendations, we can have a really good conversation with them when PUB has our work session this fall with the commissioners and start the conversation about it then. And then they can potentially, make recommendations to their bureaus about looking into this program and what would it look like, who do we want to work with, how, and see if they can get the bureaus to come back to them with, a plan on how to keep this program going and potentially expand it. So in terms of lining this up for the next budget cycle, this is kind of the perfect time to be teeing this up for council to look into, because they'll have, a good amount of time to look into whether or not this is something they can do in the next budget cycle. So it's the timing is good. We're not at the 11th hour, which is kind of exciting. And then the last thing I wanted to say, and this is kind of getting at what Kale was talking about a little bit, and also what Tom was bringing up, is, and I struggled with this. Like, I had a lot of conversations with Eliza and staff to help me understand, like, it is actually completely appropriate that we are making a recommendation that is not specific to the bureaus that we directly work with. We have the jurisdiction to make these recommendations about broadly addressing lead because there is a program that currently exists because of the lead and copper rule within Water Bureau that addresses lead broadly. And we get to have an opinion about whether or not that program should continue and how it should continue. And I think because we are an organization that cares really deeply about public health and community safety, and especially about underserved community members and folks that often slip through the cracks, that this is a really important time or opportunity for us to make a recommendation about how the city should be addressing this problem holistically and not just through this little program that we got out of the unfortunate issue of lead and water. But it just would make me really sad if we chose not to engage in trying to get the city to, at the very least, keep this program growing at existing funding levels, but actually get the city to really consider expanding it and working together with partners and other bureaus to really tackle this issue in a more holistic way, is my hope for what comes out of this conversation. The third recommendation is just that we stay in consultation with MAPS's office, which I'm just assuming we'll be doing that. But anyway, that's my bit. I would like to, I think it was good. I wanted to get all that out there because it felt like the direction our questions was going, or the direction that our questions were going, we're kind of getting into the part that I was going to try to say. So I do want to open it up again now, though, for folks to ask questions. And these are the recommendations. Thanks for getting this slide up there. Do folks just want to take a moment to read through them, or does someone want to read them out loud? What are people's preferences for how to absorb the slide?
Julia, this is Karen Williams. Why don't you just go ahead and read through them?
Okay.
Yeah.
Thank you. So the city should secure new and possibly additional funding for the lead hazard reduction program, which is currently slated to end once the improved corrosion control treatment project comes online and is proven to be effective. The city should fund a program to assist low-income families in removing lead from their homes. And I recommend that PUB regularly communicate and collaborate with Commissioner Knapp's office on issues related to lead, with a focus on plumbing, with the goal of strengthening our lead abatement programs.
Thanks, Julia. This is Karen Williams again. So let us open up our discussion among board members on these recommendations. And yeah, let's just open up the discussion. So board members, please indicate if you have a question, a comment, or an item for discussion.
Karen.
There we go. I do have video on. So I wanted to thank you, Julia, for doing this work and all of the research, and thank also Sarah for her presentation. I've heard bits and pieces before, but it's always good to rehear it. I fully support all of your recommendations. I do have a question about the city funding a program for low income families, and that was just in reference to your report on the weatherization. Do you know how that mechanism would work for the city to fund that in the private public partnership?
Yeah, definitely. The way that was done at the county level, and eventually that program went statewide to my understanding, but they partnered with Craft 3 is one of the organizations that does the low to no interest loans. They're willing to take on that kind of higher risk pool of folks because they're not profit driven. And they also partnered with unions to offer apprenticeship opportunities through the weatherization program. And there was basically a nonprofit that was kind of stood up that housed that program, that it was kind of like one-stop shop. You know, a person can come to the county and they'll send them into that program and they can apply for the grant and get the work done. And because it was so turnkey, the work could be done really efficiently. So my thought on this was, initially it could be for replacing lead pipes in people's homes. But if there's no reason that a program like this couldn't include addressing lead paint issues as well.
Thank you. Thank you.
And there's also the opportunity for the city and county or whoever else wants to get involved in this program to create, because those are low to no interest loans, but you can also have a grant program where you're actually giving the money to the lowest income families to address these problems. And I would strongly encourage the city to look at that as well, because some folks are at an income level where even a loan is frankly not a really viable option for them. So I think that that's something that's worth looking into for the program. But I was thin on the details because it really is the city, and they need to be looking at how to create such a program. But I was just listing that as an example for them to look at. They could at least realize they don't have to completely reinvent the wheel here.
Right. And I guess as I might add on to your recommendation that the first step for the city to do would be to make an evaluation of other programs and come up with a projection of costs and how many folks it would help.
I like that. I would like that addition. Yeah.
Thank
Smart.
you.
I have lost, I think, Tom, you were next.
Yeah, Tom,
Yeah.
yes, please go ahead, Tom. And I'm wondering, Karen Spencer, would you mind typing out in the chat to Eliza or to just typing out in the chat your recommendation so we have that wording handy? Please go ahead, Tom.
Yeah, so I just wanted to say regarding the first one, that just a clarification that it's not when it comes online, as you said, but when it's been proved, just to clarify that we understand it could be 6 months from now or something like that. On the second one, I really think if I'm thinking about these 10 or 15,000 homes or buildings that are likely to have the lead and plumbing. And I'm thinking that they're not all owned by low-income families. And I think the program, whatever this program is, I think it should include all of those homes, because all of those homes then potentially could have low-income people in them at some point in the future, even though they don't have it right now. So maybe helping to focus on low income, but also to get at all of those homes. So I would recommend that the program and the wording on number 2, recommendation number 2, be worked on a little bit so that we make it a holistic program, as I think you used that word earlier, so that we're getting at all of the sources, no matter who's going to live in there or who's in there now. But then, of course, low income would not have the resource. Now, I also wanted to bring up something that relates to this, and I agree with number 3 too. So I don't know if any of you know this. I think I've brought this up before, but back in the 1980s, the city of Portland was required by the state of Oregon to eliminate all of the cesspools and build sewage treatment and conveyance facilities in the mid-county part of the city. That was about 50,000 properties. It was a mandate from the state to the city. And interestingly enough, the mandate was based on removing the threat to groundwater. So, but the assigned agency that had to take care of it was BES. So BES had to force people by this mandate, and then the city mandate, that they had to abandon their cesspools, and they were required at their own expense to put in a sewage connection pipe to the city pipes that were being built. They had to pay for the city pipes, they had to pay for their own private pipes. And property owners were paying $10,000 to $20,000 per home out of their own money. There was an assistance program, but I'm just bringing this up because here we've got all of these properties, which is actually 1/3 of what it was for the county sewer project. And we're talking about assisting people and everything else, but I think there needs to be somebody in the city, and I don't know who, somebody to work on setting up a comprehensive program that gets at this issue relative to plumbing and lead and paint, but especially as it relates to us on this board, how we can get at that issue of the plumbing. And so I don't know, I think we need to talk about, or maybe even have a subcommittee, what is this program that we're talking about, and who's going to create it, and then who's going to implement it. But first, I think we need a comprehensive program that gets at this issue, and we look at funding that might be related to other ways of doing it besides what we've been doing so far. Anyway, thank you.
Yeah, no, I actually want to, I need to recheck how the full recommendation is written, because my intention is for the low interest to no interest loan program to be able to be used by anyone who applies for it, and that it would be grant money that would be made available to the lowest income folks who can't afford a loan, right? And because the idea is, like, even if you're like a wealthy homeowner, or even a upper middle class homeowner in like one of those old houses with lead paint, like dealing with lead paint is a very expensive proposition. And so a low to no interest loan, even if you're a well-off family, for trying to address lead paint is a very, very smart idea. So I think if we need to edit that section to make it more clear that the low to no interest loan, program should be able to be used by any resident, that does make a lot of sense to me. And that was my intent, is to have it that way. And in terms of, I don't know what the ultimate solution is for lead in paint, because I don't know what the percentage of houses are that have it. And I know it's much more expensive to mitigate or to address. But with lead pipes, with lead soldered in pipes, the way that they did this in cities like Paris and other European cities is once they got the number of buildings that had lead in the pipes low enough at the county level, at the whatever level that's the broadest geographic level, they can pass an ordinance that says upon sale of a building, if it has lead pipes, those lead pipes must be replaced through the process of selling the building. So that $5,000 or whatever amount of money it would take to replace the pipes would be baked into the cost of selling the home. And that's how you get lead officially down to zero from lead pipes. But right now, it's just that there's too high of a percentage of buildings where for a rule like that you got to get it down to 5% or lower than that or something. But so I think that this is a program that helps get us to that lower number if it's implemented right and communicated to homeowners.
So just a clarification, you're saying that currently in Portland, there's no requirement to address the potential of lead being in the pipes when a home is sold?
Nope.
Oh, I think, well, that to me is part of a comprehensive approach, is looking at using mechanisms like that to help get at the issue.
I mean, the feedback I got when I had conversations with folks at the county was that the percentage of homes is too high for such a rule, but if we got it down lower, that would be something that they would be willing to explore. So but I mean, that's a conversation that should be in the conversation when we're trying to develop this program, for sure.
Robin Castro, please go ahead.
Yeah, this is Robin. Just wanted to thank both of you for the presentation, and thank you, Julia, for writing this. I was able to read through it, and I believe that I support all of the recommendations. And the only thing that I would add, I think it's important in the first paragraph that we specifically address that we are having tested water with high rates of lead. And while we understand that it's not specifically coming from our water source, that we are regularly having those tests state that we are at or above the action lead level. And I think it's really important that we are stating that, because we're not just addressing lead as if it's not really impacting us. We're specifically addressing lead in this circumstance because the city of Portland keeps having high lead level tests, even if it's coming from a small percentage of housing. And so I think it's really important that we're mentioning a sentence in the background first paragraph saying that the reason why we're even here is because we are still seeing high lead levels being reported. Thank you.
I mean, and I think, thank you for saying that. I felt like it was implied because we literally had to do the lead hazard reduction program because of those elevated lead levels. We were literally in violation of EPA regulations, right? So, but maybe we can add a sentence in there that clarifies that. And the reason why this program is going away is because the city is, actually addressing that specific issue with this program and will hopefully be effective. But I totally understand what you're saying. I think you're right about it shouldn't just be implied; it should be explicitly stated. So I'm okay with adding that sentence.
Okay, I don't see any other board member hands raised. So I am going to ask a question myself. This is Karen Williams speaking to Julia, to both Julia and Sarah. But whichever of you would like to respond first. My question is, and this is a question, not a comment or a recommendation, but I'd like your thoughts on whether we should mention in our recommendations our support for existing practices and or support or recommendations for existing practices. And I'm thinking particularly about the policy that the city currently follows with providing filters to households where lead levels have been tested high. So do either of you think, and my understanding is that will continue, that the funding for the testing and the filters is not part of the funding that would go away once the corrosion control treatment is complete and we no longer have the lead hazard reduction program funding. So should we mention anything in the memo about existing programs that we recommend continue?
I think if that gives people a higher level of comfort, and it also just makes sure we're not leaving anything to question. I'm fine making this document as comprehensive as possible, and saying that we should continue those programs, because you are, and Sarah, you should correct us if we're wrong, but I am under the impression that yes, those foundational programs will continue. If people are finding that there's lead in their drinking water, we will absolutely be providing them with free filtration.
I can say that I really can't answer like the filter question right now. As I mentioned, I was in a meeting just before this one where we were talking about like our testing program and all the ways that we're going to, which types of homes we're going to be actually reaching back out to and retesting to compare lead levels. So there's over the next year, because we're in such a transition of, our improved corrosion control treatment just came on. We're really excited to see how that's going to work and how that's going to play out in all sorts of situations, our high risk homes, in our multifamily units. We're going to be retesting at homes where we have provided filters already, just to compare, to see the effectiveness of that treatment. So we're going to be looking at all of this stuff, and I know that, our lead and water treatment, or our lead and water testing program, customer testing program is a foundation of, what we do, and is a really great service. And we're going to, as we're getting more data and information from folks, we're going to be making some of those decisions about, the future of the program. But, I fully support the board making, whatever recommendations you feel, because that, that'll just signify and let, Water Bureau managers know, what you all are recommending us do and carry forward. So I definitely support you all in making whatever recommendations you feel is necessary and helpful.
That's it, Karen. Do you want to? I want to make sure that I understand. Are you saying that you want to make sure that the city continues that the baseline program of providing free testing and water filtration if people find lead in their water? And if that is what you're interested in adding, I think it is worth considering. But I don't know. I want to make sure I understood you.
Yeah, thank you, Julia. And yeah, I'm sort of taking off my facilitation hat in saying this, but yes, that was the I guess the underlying recommendation that was in fact behind my question, which was that just personally speaking as, again, a board member, not the co-chair and the, and the facilitator of this discussion, that I thought it would be important to reflect the board's awareness of programs that are in place that are playing an important role. And I just thought it was important to have that documented, just to show that the board is aware. The board has been informed of these programs, and we support them if in fact we do. And in the context of your memo, it would be recommending that these programs continue. So that was, now I'll put my facilitator hat back on. And I want to ask, we do have a member of, I see your hand, Robin. So we do have a member of the public who has a question, but I want to make sure we have gone through and made sure that board members have all of their questions answered. Once we have if we have a motion, if anyone chooses to make a motion to move these recommendations forward, then, or to adopt these recommendations as a board, there would be a public comment portion, after we make that recommendation before we vote. So I just want to clarify all that. I'll go to Robin for question, and then if no other board members have questions, then we'll see if we can answer the question from the member of the public. So
Yeah,
Robin,
this
please go
is
ahead.
Robin. I actually just wanted to say that I agreed with what I think Tom was alluding to, that we could also perhaps offer some critiques of the Bureau's current mechanism of addressing this in reference to like running your water for 2 minutes, et cetera, et cetera, et cetera. And I wonder, I think that we should do it, but I wonder if it's the right move to put it in this memo, or if we should actually do a following memo to be like, hey, these are perhaps the critiques that we think that you could address in the current system. Because I definitely like the current memo, and I worry about, I want to address the criticisms, but I would worry if would we prolong this conversation too long, or if we should just have like a follow-up memo to be like, essentially my personal critique of like the 2 minute running your water for 2 minutes, who pays for that fresh water? That's a limited valuable resource, etc. And just, yeah, I guess just that.
Yeah, this was actually going to be my next kind of question, which is, there have been enough suggestions that require additional sentences or tweaking of existing sentences, and I'm not sure what the best way is to proceed. I mean, we could do, I don't even know if this is an option, but like one option could be that we adopt the memo, but try to incorporate some of the changes that people have talked about. But then that means we're adopting something that is going to be changed. So I don't know if like that's even possible, or if we want to try to add these things in live in real time during this meeting, which I don't know if we have time for that. Or do we want to have myself and pub staff like add these additions and updates that have been suggested in this meeting? First of all, we'd have to like probably have a motion for that, right? Like we approve X, Y, and Z additions to be fine-tuned by staff. And then we'll adopt this at the next meeting with those changes. I just don't know what this is where it's like, I don't know what the best process is for moving forward with this in an ideal way. And I'm hoping somebody else can jump in.
Yeah,
and help me out here.
I have a suggestion. And so Julia, again, speaking as facilitator and co-chair, I do not think that the memo that you have sent to us needs to be adopted in any way. It is part of the record. It has been submitted to the board. So I think that if we were to vote on an action, I think it would indeed be adopting the recommendations themselves. And those recommendations, as you pointed out, will be used in multiple communications probably that we have with the city ongoing, in the work session coming up, in budget recommendations next year, et cetera, et cetera, et cetera. So I would suggest to the board that we vote on adopting the recommendations and that have been presented. And I think we could spend, we've had 2 or 3 pretty succinct recommendations that I think could be added in. And I'm also hearing you say, Julia, that some of you would prefer to have some more time to work in some of the more nuanced recommendations.
I don't know that I want more time.
Okay.
I think
Okay.
that, like, you're right. What we're doing is, like, the action we could take today is making these recommendations to the council and running with them. And so I think certain updates to the memo are that folks are talking about are not recommendation related. They're more about the context of how we're talking about the program. But I feel like I wonder if it makes sense to, just go ahead and, like, maybe we could make a motion to adopt these recommendations with the addition of, and just outline, like, the points, like, that we should have we support a program that would offer grants to low-income families and low to no interest loans for everyone else, kind of thing, like making sure that that language is clear. And Karen's recommendation was also a recommendation level edit that I think she hopefully sent a sentence to someone about recommending that the city look at existing programs to kind of try not to have to reinvent the wheel. So I think, those are, off the top of my head, those are the 2 things that were said that really need to fall under the recommendation section. I do feel like we could go way down the rabbit hole in terms of what Tom was talking about like specifics about how do we actually address this holistically. But I think if we use broad enough language, we don't have to get overly specific. We can, through conversations with MAPS's office and through the work session, have a deeper conversation about what does holistic mean to us. That's my instinct.
So let me, so that sounds great. Let me look to the board for a moment and just get a kind of a thumbs up if people would like to proceed with looking specifically at the recommendations and a bit of not wordsmithing, but additions to the existing recommendations. Shall we spend 10 minutes or so doing that and then make a decision about whether we want to adopt those recommendations? Are people on board with that process? Okay. I'm seeing a few thumbs up. Okay. So let's proceed with that. And kind of building this plane as we're flying it. I'm wondering if Amy, I believe, is our screen sharer. Would it be possible to bring up a Word document or something that we could be?
Yes, we're in the,
Yeah.
This is Eliza, and we are in the process of doing that. There was a cross-platform technical glitch in the version we'd been sharing earlier because it had been developed to be used on a Mac or Windows, but on OneDrive, it doesn't work. So now it should work. And so Amy's bringing that up.
Super.
Technology, can we live with it? Can we live without it?
Okay, so that looks like, so maybe if we scroll down to the actual recommendations, because we're not going to wordsmith on background and context right now. So this first recommendation, funding a program to assist low-income families in removing lead from their homes. And Karen Spencer, is this where your additional recommendation would fit?
Yes. Yes.
Okay, and I understand that.
And I did provide language. and
Yes.
I like having a concrete action step that can be resourced as part of the proposal.
I like how you think.
Oh, okay, there it is. I see. As a first step, the city should resource a team to develop proposals for a public-private partnership program that includes, number one, the funding needed for programs. Number two, projections on the number of families, including the number of children, parenthetically assisted, and three, options for loans and potentially grants to the lowest income families. Great. Okay. So I believe then, let's see. So the other, this, I'm going on my memory now, but the other kind of bucket of of recommendation was around the more holistic, more comprehensive treatment of lead, and recommending that the city adopt such a more comprehensive program. Would that, I'm hearing what you're saying, Julia, that that's more, wouldn't necessarily fit concisely into one of the recommendations, but I guess I want to ask mostly Tom as the person who spoke to this. Could you come up with kind of a shorthand of that recommendation to add to possibly either recommendation number 1 or 2?
Okay, so as I'm looking at what we're doing right now, I would find and hope that what I was talking about could fit within the structure of Karen's,
Yeah.
Okay.
with only slight modification to what
Okay.
Karen has. So if I could say, for instance, in Karen's, the city should resource a team to develop proposals for a public-private partnership program that includes, so I would say, whether it's public-private partnership, which I think is great, but what I was getting at is that it should be comprehensive, that we want to definitely assist low income, but we want this to be comprehensive because we want to get lead out of our environment, our living environments, well, and the outside environment as well, which we do live in. So I would just try to add it to her so that we don't get too much excess verbiage here, but so I would, let me see how you're, so options for loans, et cetera.
And I almost, my recommendation, Tom, is that you just state your recommendation as I'm hearing you say that it could fit within Karen Spencer's, but I think for clarity, it might be better if you just stated your own recommended addition language rather than trying to.
Okay, so mine would be recommend, adopt, actually develop and adopt a comprehensive approach rather than using holistic, but a comprehensive approach to get lead out of the pipes and the paint in all homes that need it or have it at levels that need to be remediated or corrected or removed.
No, I really like that because it does get at what was my goal, which is lead down to 0.
Yeah.
And,
right.
and making that really like a stated goal in here is smart.
As your scribe, can I ask, I'm trying to channel your all's energy. This is Eliza. And so Tom and Julia and Karen Spencer and the whole board, I'm gonna not mention, to get out lead, to get, we'll wordsmith later, but to get the lead sources out of home. And I don't want to specify because as you remember from whether it's paint or a pipe or a Venetian blind, I just want to actually, because it felt like you all were saying you want to be able to support people and all of that. Am I capturing your all's attention?
Yeah, comprehensive. So I would say sources too. Yeah. Keeping it as broad as possible. Yeah.
Well, then take off the last part of that sentence where it says that have lead levels that necessitate removal. I think going back to what we've heard ourselves, as well as what we've heard from the public and regulators, is there's no safe level. So just put a period at the end of homes. So take that out, keep going, and then just put a period at the end of homes. Get the lead out of all homes. And if we need to qualify that later, but I think that's what we're talking about. If there's lead in any homes, this program, even as it relates to like refrigerators or other things that might be in homes that are not in the category of 1970 to 1985, if lead is bad at all levels, then we want to tell people that might have plumbing or appliances that could have problems. And this is all related to, well, refrigerators not, well, it is related to water. But anyway, that's what I'm getting at, is that let's make it comprehensive. And then within that comprehensive approach, we can have levels of attention. So get the priority levels first, help the low-income folks first, but help get lead out of buildings in Portland so that everybody's safe when they're using the plumbing in those situations. And thanks, Eliza, for trying to put that into a written word.
And I do appreciate why you're saying Portland, but I am like, there is a strong recommendation within the recommendations that they partner with other jurisdictions, because if we're not dealing with this at geographic levels, like county to state, like, then we're leaving people out. But that's
oh yeah, I don't want to leave them out. I'm just saying,
yeah,
that geographically Portland, as it relates to partners, yeah, we should have.
Yeah, I don't think this program will frankly work or be viable if it's not countywide. Honestly, they're going to need a partner in the county. But like, that's why I don't think that has to be in this sentence, but I'm just saying that is a part of this recommendation, because I feel like it's a public health issue, it's a housing issue. The county really needs to be, and they have resources. That's another way to expand the program. So, but that is written elsewhere in the recommendations. But I'm just putting that out there out loud to all of you that it's like, ideally this program will not just be for the city of Portland if we're doing it right.
I do wonder though, who is the entity that would take on this task of developing comprehensive public-private partnership?
I mean, that's part of the cities and the county would have to make that decision together, and they've done this before. I mean, our recommendation is trying to prompt them to do that. That is their job, right? Is to develop programs. They have policy wonks on their staff. This is like, I know we feel like it's our job to give them like a fully baked solution, and it's like we can tell them what needs to happen, and they should have the resources to begin to wrap their minds around what that looks like. And we also, like I said, in working with Max's office can help connect those dots. I know that Sarah is in regular consultation with folks at the county on addressing lead, because it's kind of a joint effort already with very minimal resources. So I think there's a lot of those connections that kind of already exist that we don't know about, but I don't want us to get too caught up in spoon feeding them what the solution should look like. We should be able to feel like the city is competent enough to hopefully develop this program, and that we will help guide them through like continued consultation, but I don't think it has to be spelled out in the memo. Does that make sense?
It does, but it also sort of doesn't.
Tom, can I just interject, please? Please accept my apologies. So I'm hearing you both. I think we're kind of straying away from getting our recommendations agreed upon. and implementation, great points, but let's try and stick to the recommendations, and if we can get to something we could agree on today. And I see Karen Spencer has her hand up.
Something that was part of the conversation a little bit ago really resonated with me, and that was the lead zero goal. And so I want to do either a slight tweak to Tom's to either say a comprehensive lead zero approach, or just to say at some place to be determined that it should be a lead zero goal. And then I think that there was a third recommendation that we should be getting to as well. And that was yours, Karen Williams.
Oh, yeah.
Right. I was thinking, I was going to turn the floor over to Robin in a second here too. I think my recommendation almost suggested recommendations to essentially continue existing programs that are working almost kind of goes more in the context and the talking points and the why are we here part of the any communication that we have. So so I don't think we need to put the recommendation personally to continue existing successful programs in this list. So that I guess I will withdraw my recommendation in that sense. But Robin, you had suggested if we're recommending things that are working, continuing, we might also want to recommend critiques or suggest critiques of programs that we don't think are effective. So I want to give you the floor for a second to respond to that. Is there anything that you would like to offer to the existing recommendations or a new recommendation that we could add today? Or would you prefer to hold that sort of deeper critique of programs for another forum?
This is Robin. I think it might be best to hold that deeper critique for another forum, but I definitely think it's a conversation we should be having. And then when we're done with this part, I do not want to forget the edit that I made for the background paragraph as well.
Would you want to?
Okay.
Should we take that now?
It's some text via chat that I can add in.
So I'm sorry. So again, just to clarify that we're not wordsmithing the memo. The memo's been presented as it stands. We may use this memo context. We may in fact come up with a memo we want to send to City Council that's going to look different than this one. But right now we're just focused on the recommendations. So hearing you, Robin, that your suggestion for an edit in the background section, we won't forget that. But do you have anything, does anyone have anything that they would like to add to the recommendations themselves before we decide if we want to adopt the recommendations?
I just want to say that in looking at this, I think Karen's first recommendation up there covers everything that I'm thinking about. So I think just to simplify and try and you could remove my recommendation because I think it is covered under what I see in Karen's recommendation. Just to try and keep things simple.
Okay. All right. So then, okay, good. So in that case, any further comments or additions to the recommendations themselves that people would like to get on the floor?
I think in terms of just the addition of the part of the recommendation is, oh, never mind. You were just rephrasing what I said. Never mind. Sorry, I retract that comment.
Okay.
One
right.
last question.
Yes.
So I know we're not going to get at the background now, but I noticed a couple typos and things. And are we going to? Can we turn in some edited versions of the background to Eliza and Amy and Julia later? Not right now, but can we just send that in?
Well, here's my suggestion is that, again, today we just as a group agree on the recommendations that we want to make to City Council. And I would suggest that we save to the next meeting how we want to convey these recommendations. Maybe it's in a memo, maybe it's almost certainly going to be in some written form. And then, at the next meeting, we can have, well, I'm sorry, I'm getting out ahead of myself, but Tom, can we hold that? Like the memo editing itself, can we hold that for a second and maybe we can come back to that at the
Yeah, I just,
end of our.
that's a thumbs up. I'm trying to say, yes, I agree.
Yeah,
with what
okay,
you're saying. I'm sorry, I guess it looks like a hands raised.
That's okay.
Part of our technology. Yeah, that sounds good. Great.
Yeah, let's come back to the memo in just a second, but on the recommendations, I'm not seeing any other comments or additions to the recommendations. So let me just acknowledge our member of the public, Doris. Do you have a question or do you want to make a comment?
I want to make a comment. Can you hear me?
Yes, and Doris, we're going to move to public comment momentarily. So I just wanted to acknowledge, we know you're there. We see your hand, and we will open the floor to your comment momentarily. Okay, so with that, we have the recommendations as presented by Julia DeGraw and as edited and added to by the board. A motion to adopt the recommendations would be in order. So I would ask for that motion from someone from the board.
I'm willing to selfishly move that we adopt the recommendations that I made to address lead issues in people's homes and buildings in Portland.
I will gladly second it.
All right, excellent, thank you. So motion on the floor to adopt the recommendations made by Julia DeGraw and seconded by Karen Y. Spencer. And we will now open public comment before we vote. So Doris, please go ahead with your comment.
Well,
And if you can.
I will be brief.
Yeah, hold it to a minute or so would be just great.
Okay. I think what you're doing is absolutely wonderful. And I wanted to, I am a participant in the city's water testing. My water is tested every month because I have high lead in my household plumbing. And so I send in my bottle of water every month to the engineers. I wanted to make sure that you are going to be recommending participating and getting grant funding from the new Biden infrastructure funding that is providing billions of dollars to cities to upgrade address the problems of lead in drinking water through the use of the drinking water state revolving funds. I'm sure you know about that, but I wanted to be reassured because this program is focused on providing at least 40% of the grants and loans to disadvantaged low-income communities. And they address lead service lines and other lead plumbing issues. So I'm sure you know about that, but I just wanted to make sure. My other comment is there are now fixtures required in California that are zero lead in faucets and premise plumbing. And the city should be making it possible for homeowners, landlords, renters to know when they buy new plumbing, they should ask for the zero lead fixtures. The ones that have been sold for the last 20 years or so have been found to contain enough lead to still be a concern. And that's why California passed a law to require that only the zero lead fixtures be sold. And so I just thank you. Your focus on getting as much lead out of our homes is wonderful, and on helping the poorest among us is wonderful. So I just thank you for what you're doing, and I will be quiet.
This is Eliza, your scribe, and before you call for the vote, Karen, I just want to make sure people notice that as I was scribing, I've put some of the minutes in there, but above it are the couple of additional recommendations to Julie, as primarily the one that came from Karen Spencer. And so your motion for the record is really to adopt the recommendations Julia brought forward to you, along with the additions that you all discussed and agreed to that are up there in red at the top. Did I just confuse everybody?
Well, a little bit, because some of those notes are more reflecting the discussion than an actual change to the recommendation.
It's really just the first one that says Karen YS.
Exactly, right.
And so
it
that's
might,
all. It's just that addition that you all agreed to.
yes,
Sorry.
that is my understanding. The maker and seconder of the motions, is that your understanding as well?
That is my understanding. Thank you for clarifying that.
And great, thank you. And thank you, Doris, for your public comment. We really appreciate you being here and taking time to comment. Okay, so in that case, any further discussion among board members on the motion to adopt the recommendations?
I did have something, since we're talking about what's highlighted in yellow. It seems that item number 1, it says the funding needed for programs. Wouldn't that be funding needed for whatever's needed? And maybe programs, Karen, you're intending that to be comprehensively applied, that it covers everything, but could we just say funding needed, the funding needed, instead of qualifying it for programs?
That would be fine.
Okay.
I would be, yeah, that was the intent. It actually turns out when I speak, it's much harder to actually write a written proposal.
Well, you're not the only one.
Right. And then
Always.
I wanted to acknowledge Doris's comment while I had the opportunity. I would look at that for the city to do as part of the evaluation, the whatever sources might be available through the federal government.
And it's another really good reason for them to try to be thinking about a program like this, because funding like that is going to suddenly be available and you need a place to put it. So it's actually really good timing.
Yeah, yeah.
Great, thank you, everyone. Looks like Kale has a discussion item. Yes.
Yeah, I think with the removal of for the program, might I suggest that if there was a specific program that you name it, because I think just stating the funding needed leaves too much room. So leaves too much room for where funding to go. So if there's a specific program, I prefer to see you name it, or if the intent was just to say, you know, it's about money and then you can use it anywhere you want, then I think that's appropriate.
So Kale, are you asking for some clarification from Karen Spencer?
Yes, where
On
it says the
what Karen
funding
was
needed.
intending?
Exactly, because I think there needs to be some.
I think that's a good idea. I just intended it to be an initial evaluation of like, hey, this is what we need, and then allow them to determine where they're going to get the source of the funding from.
So Sorry, this is Kaliska, just to step in. I thought in the recommendations, we had already specifically talked about the lead program that's already in. I mean, I think we do have specificity to continue to fund that. Am I?
Yeah, they're kind of two different, the baseline recommendation was please continue the existing program at least its current funding level. But the current program is not the thing that we're talking about in this recommendation of, you know, grants for low-income families to replace their lead pipes and low to no interest loans with public-private partnership. Like that kind of program for lead does not comprehensively exist. And so it is a little bit muddy in that way because there is an existing program, but we are asking for them to go kind of above and beyond that existing program with this recommendation.
This is Eliza, and I would also add that, and I wonder if it's just a matter of after the fact, making sure that, because there's a difference between speaking and going to writing. But I think the way it's written, what Karen's proposal is actually saying is the city should resource a team to develop proposals for this public-private partnership, and that those proposals should include, you know, an assessment of the funding needing, a projection on the number of families assisted, and options. You know, some development of these things.
Yes.
That's, I think, Karen, did I read your proposal right?
It's correct. That's exactly it. Yeah.
And so it's not actually, so everything is referencing back. It's the beauty of complicated sentences, but it's all referencing back to this initial develop proposals for public-private partnership.
Right.
I think there's one item that we missed in this, and I would suggest that we try and put it in as a timeline. In other words, develop these proposals to do this within, say, 10 years or something like that. In other words, let's get the lead out, not in 50 years, but some kind of thing that we would recommend to City Council.
The recommendations I was getting from folks at the county when I was having this conversation was aggressive would be 10 years, less aggressive, but very doable would be 20. So maybe between 10 to 20 years.
I'd say 10.
I mean, I love that. But then, and that was also when we were just talking about lead and pipes. Paint is a lot harder. But yeah, let's say 10. And then if it takes some 20, then so be it. But I'm okay with making a recommendation of 10.
May I ask some clarification?
Hang on, Cal. So let's do one thing at a time here. So I heard a recommendation that we're going to add a timeline. Where do you all want to add that? Is that an introduction for all the recommendations? Is it just specific to developing these proposals for new programs?
It might be able to be adopted into Karen's, just saying that, like, with a goal of getting lead down to 0 within 10 years, or you know what I mean? Just like an add on to that.
Okay, well, all right. So I see you're typing, Eliza, but again, we're kind of mixing notes here and recommendations, but could we add a sentence? Yeah, perfect. Add a sentence up at the recommendation itself that we recommend a goal to reach lead 0 within 10 years, something like that.
Yeah. With a goal to reach lead 0 in 10 years.
Beautiful.
Perfect.
Okay. And I'm sorry, Kale, did you have a additional comment?
Yeah, no, I just wanted to ask some questions, and maybe this is to the board, not to the board, but to the Bureau. Because I think of these goals at lead 0 is it achievable, and how do we measure it? And so is it possible to have completely 0 lead? And if not, do we want to set a level where we want to be at and identify it? So the first question is it possible to be at lead 0?
So Kale, before we get too weedy here, I'm hearing your very good question and the feasibility. But I also want to sort of keep us at a high level that we're making recommendations and goal setting. You know, we're trying not to get too far into the weeds and telling the city exactly what we want them to do and how they get there. So can we, do you need to have that question answered in order to make a decision on these recommendations? Because I don't think we're
feel
going to
like-
be able to answer that
I
question
feel
today.
like we do, because I feel like if we
Okay,
send a
okay.
letter, if we send a letter saying that we want it to be at 0 lead in 10 years, and if it's not possible, it'll just be brushed off. Whereas if we say, if we want to be lead levels at by, let's say 5%, or, you know, a number where we deem is appropriate, and achieve it by 10 years, that it's a more achievable recommendation, and we're not getting into how you get to that percentage. I feel like if we throw something that is, you know, not achievable out there, it's not a very concise recommendation. Do you know what I mean?
Okay. Okay. Yeah.
And
Fair,
those
fair
for
point. So,
water it is. For water it is. But yeah, I don't know about the lead paint.
This is Eliza, and you have a couple people to call on, and I have a suggestion as your scribes, sort of watching the conversation. I wonder if reframing that recommendation so it says you want an aggressive timeline and you want an aggressive reduction in lead levels, and that you you use a word like aggressive or whatever adjective you all feel best captures that intent, and that you leave some of this details for a conversation at your annual work session with the council. Because I think what will happen is you'll have a robust conversation with them on this topic. All of you, council and you all, will come back with a lot of questions that you can then follow up on and revise and make, you know, if this moves forward and as it moves forward, you'll have additional touch points where you can give more specific input.
Aggressive timeline seems like the perfect, like specific but not too specific recommendation. I'm okay with that.
And then you could say aggressive reduction in lead levels as well. Just would that meet everybody's concerns?
Sounds good to me.
Thank
Are
you,
you
Eliza.
okay? Are you okay with that, Kale?
Yeah. No, I was okay with like having 0. I'm just, you know, I just want it to be, I wanted to have more of a, like, if it's not achievable, then I don't think it's a good recommendation. But if it's achievable, then certainly we want it to be at 0. So
But I
that was
think since
all I'm
we-
trying to get at.
Yeah, since we can't answer the question though, I think that aggressive is the right language. Because you're right, it's, you know, we're gonna learn more through the process of going through the process, but I don't know that we can answer that question in this meeting.
So then Eliza, would you change that up there on the yellow thing, the yellow part?
I will try to get up there and type. I want to acknowledge that Kaliska had her hand up for a bit.
Oh, sorry.
Yeah, I mean, I think we answered the statement I was gonna make, so I'm fine. I don't want to put a actual percentage because I don't want that responsibility on us as a board.
Are people, yeah, I'm liking aggressive timeline and aggressive reduction in lead levels. Okay. Terrific. Going once, going twice before we call the question. All right, hearing no further discussion, having had public comment, we will proceed with our vote. Karen Williams, co-chair, votes yes.
Oh, sorry, did we start the voting? I'm so sorry. Kaliska Day, co-chair, voting pub member, I vote yes.
Tom Lipton, voting member, I vote yes.
Jasmine is number 4. I'm number 5. Karen Spencer. I vote yes.
This is Robin, voting member number 6. I vote yes.
This is Julia, voting member. I vote yes, and thank you all.
This is Teresa, voting member number 8. I vote yes.
Gail, voting member 9, I vote yes.
And Jasmine, are you there? Did you have a chance to, can you unmute?
Yes, this is Jasmine. I vote yes.
Great, thank you, Jasmine.
Also, I noticed, and I hadn't had a chance to give Gabby a number. Gabriella just joined, and so if she was here for another conversation, she may want to vote yes, or she may want to abstain, depending.
Okay, I'm sorry.
Thank you, Eliza. No, yeah, sorry. So much later than I would have hoped. But yeah, I think I'm gonna abstain for this one because I wasn't part of the new additions. So thank you.
Well, fantastic. That is everyone. So thank you. The motion passes. Again, Julia, Sarah, thank you so much for your work and your research on that. And thank you everyone for the inputs and very robust conversation. Sorry.
I just would like to say really quick, Karen, thank you for facilitating that so beautifully, because that was a lot to navigate. So thank you.
It's easier when you start with something that's really greatly done and organized and thought through. So very good. So we're going to take a quick break. And I apologize for, well, anyway, I'm not apologizing. We had a great conversation, but let's just take a quick, like 3-4 minute stretch break. Okay, 5 minutes. And we'll come back, and I think we can get through at least, I hope, a couple of the financial assistance debt recovery recommendations. So we will see you all at about 12:12. Thanks, everybody.
So Amy and Eliza, for the second half of this, I can't remember. I think, is it Amy who has the slides, or one of you guys has to share what we have left, I believe?
Yeah, hi, Kaliska.
Yeah.
Amy's been doing all the slide driving, which is a very hard job, and I've been doing
It
some
looks like
back
we
end.
are back. I'm going to be quiet for a minute, a few minutes, and let Kaliska take over. But I just wanted to suggest, as far as next steps on the memo itself, if Julia, you'd be willing to see, or Julia, are you back, Julia?
Yes, I'm right here. Yeah.
There you are. What do you think, Julia, about taking the everything you heard today and crafting, revising the memo as presenting it to City Council, sort of directing the memo to City Council, not Pub, and then incorporating the revisions and so forth that you heard from all of us today that would go more in the background section and that sort of thing, and then bring that memo back. The memo itself is like a document that Pub would adopt the whole thing and present to City Council.
Yeah, I'm happy to work with staff to develop
You're
that.
muted, Julia.
Well, but I'm not anymore. Oh, can you not hear me?
I can hear Julia.
I can hear Julia.
That's really weird. Yeah.
We're not hearing you for some reason.
But other people are hearing me.
I can hear you as well, Julia. So I don't know if it's a problem on Karen's end, maybe.
Karen, can you hear me? Karen, this is Tom. Can you hear me? Look, I can hear
We'll be fixed in a
Kaliska.
second.
Yeah.
Can you hear us now?
Yes.
Okay, cool. That was
All right.
That was it was my my really silly error.
Oh no, I've done the thing where my earbuds were plugged into my computer, and then I was like, why can't I hear anybody?
Why can't I hear you people?
It's like my earbuds were plugged in, but not in my ears. It's like the whole thing. But yeah, no, I was just saying that I'm happy to work with staff to do that. My only concern is that I am genuinely not clear on what you were talking about, Robin. So like, I might need to have a one-on-one with you to try to make sure I'm like getting what you were trying to capture in there. So anyway, but other than that, I'm happy to work on doing an updated version that's aimed at the council.
Julia, this is Amy, and Robin sent me some language, so I have that language that she sent. So obviously there can be more conversation between the two of you as well if needed, but she did send some language, so I can capture that.
Awesome, cool. Yeah, send me whatever notes you captured about what folks wanted to add in, and I'm happy to update the document, and then we can work on it together.
Thank you, Kaliska. The floor is yours.
All right. Okay, so I think we're just going to continue on with our list of recommendations. So I don't know, Eliza, do we want to kind of talk about what they're used for at the end and just try to get through as many as we can? Because I know that we had quite a few left. If I remember, it was like 20 of them or something, if I remember right.
I think, thanks for asking. This on the slide is just a reminder, and we've talked about it for a while.
Okay.
So I think we could just open up the document and see where we get through, probably with the recognition that that's where you're going to get through for this year, since we are going to be hearing from Teresa and Karen Spencer in June, and possibly again from Julia as well.
Okay, so just, I guess, kind of a reminder that this is sort of a running active list, and that this is something I feel like is more kind of an, I don't want to say an archival, but a document, reference document we can refer back to as far as discussions that we had with the board, and when updates and new things come through, we can finish the use them as needed. So, okay. So is this where we left off? So 20, recommendation, explore possibility of allowing customers to make a donation if they choose. Can go towards that cannot pay as much as a private utilities. Oh, suggestion came from a member of the public. All right, so I'm not sure on this one if, yeah, I guess maybe I would agree with using the word explore. I know in other states that I've lived in, there is that little checkbox like, hey, do you want to donate $4 or whatever to help others? But I don't personally know how that works in Portland. So I'm fine with leaving the wording as is, explore possibilities. So I guess so this is open for discussion. So is there anybody else? Do we have any concerns about how the recommendation is stated as is in the black lettering? Thumbs up from Julia. Thumbs up from Tom. Okay, so if there's no opposition that I'm seeing, thumbs up from Gabby and Kale. Okay. All right, so we'll go support as drafted. All right, on to the next one. 21. Estimate the scope of the problem. So Eliza, you might have to help me on this one and what this is referenced to. So how many renters both pay their utility bill through?
This, yes, let me see, let me put my glasses on so I can read. Yes, this was actually, I think the complicating factors, because we've been doing this for so long, you adopted a bunch of recommendations related to assisting renters. And this was the one that had some no past discussed stuff. And so you haven't had a chance to discuss it yet. And I believe this came from Robin. I may be wrong, Robin, and I apologize if I am, but the question was really, the recommendation is that you really literally try to understand the scope of the problem a little better about how many renters are paying their utility bill indirectly through rent. And if it were not for that, would actually qualify for the financial assistance programs. But and so Robin, you speak because it was your thing, I believe.
Yeah, this is Robin. It was my recommendation, and I think that Eliza said it pretty well. But my personal interest in this was that, like, there was an audit released, I think in February of this year, that said that multifamily units are essentially subsidizing water assistance programs for people who in single family residences, but they could not themselves access it. And the Water Bureau currently says that they help apartment renters, but only if you go through a third party source. And so we essentially within the Bureau have two different mechanisms of helping people if they live in a single family house or if they live in an apartment building. And currently, you could live in an apartment complex and qualify for the low income program that the Bureau currently has. But because you're in a multifamily unit, you do not pay your water bill directly to the water company. You pay it through a third party. And so this essentially wants to address how many apartment renters would qualify for the current Portland Water Bureau financial assistance program if the assistance program was solely based on their income. And trying to really find that number, and that way we can see within our current systems if we can try to like essentially eliminate that. I don't want to say too many more words.
So I guess basically the recommendation or kind of the ask is, hey, can we kind of look at this and make this more accessible to everybody rather than just kind of what we have at this moment? I mean, this is very high level, but kind of. Tom. Oh, sorry, Robin, go ahead.
I would say let Tom go and then I'll formulate my thoughts.
Okay, go ahead, Tom.
Thank you. So I just wanted to mention, I was doing a little research on stuff, and I discovered from the Water Bureau that, anybody that has a meter gets charged a base charge. And actually this relates to me reading the rate study, which I'm sure all of you are really digging into. And the rate study says, if I'm not mistaken, that they're not going to look at the base charge. So that's one thing. So then I called the Water Bureau and I asked about the base charge. So it turns out that all apartment buildings, no matter how big they are, they pay for the meter, the base charge. So that's about, rounding it off to about $18 a month. It's the same price that a homeowner pays, which is $18 a month. So what I'm getting at with that is that because apartment units, that kind of cost gets split up by all the apartments, then that's one way that apartment users have a little bit lower fee. And then the other way that they have a lower fee is that their impervious area is usually much less than the average 2,400 square feet that a house is charged. So they say, I was looking at it, they save about $35 a month, generally speaking, from what a single family residential would charge. So in a way, they're not getting a discount or anything, they're not getting any help. That's just the way that the numbers work. So unless I'm really off on that, maybe somebody at the Water Bureau or BES could double check what I'm saying, please. And but I just wanted to put that out there so that it's a little bit of the information that we're saying, understand the scope of the problem. And one of the issues is that at least they don't have to pay as much usually as a single family residential property owner does. But I'm in favor of this.
Thanks, Tom. Robin, go ahead. I think you wanted to.
Yeah, give me a second. I thought I had my words. I think the main question that this recommendation is trying to, or the main issue that this is trying to address, is that the Water Bureau says that they do offer us financial assistance programs for apartment renters, but the issue is that you have to have a case and a case manager through a third party where you have to be literally at the risk of eviction in order for them to even think about offering you financial assistance for your water bill. And that the issue is that it's unfair that we're putting apartment renters on the verge of eviction before we're even helping them. And very much the Bureau has previously spoke on this and said, like, we don't know how to necessarily calculate your monthly water bill if you're through an apartment renter because it's indirect. But the issue is that, like, I still get a water bill. It shows the last 12 months of my usage. So we absolutely have the capacity to be measuring that. And I think we're just trying to dig into that, see if we can get concrete numbers out of how many people who live in multifamily units would qualify for the current low income assistance program if everyone could qualify for that program solely based on income and not what type of housing you have.
Gotcha. Okay, I understand it a little more. Thanks, Robin. Okay, so I think that's sort of what the recommendation is. So at this point, if there's anybody who does not support this, raise your hand or let us know. All right, so we only have like 4 minutes left. I don't know if we want to go on to the next one. It looks like we had an 8-to-1 on this one, so I feel like, Eliza, maybe this one would be a very short focus on building trust and relationships, work with trusted community partners to get the word out about financial assistance programs. I feel like we have talked about this multiple times through other things. Karen Spencer, go ahead.
So, and hopefully I don't derail stuff. I was really interested in talking about number 35, exploring the possibility of a tiered rate system. But I am open to any others that other members would like to discuss in the moments remaining.
I support 35. That seems smart.
Okay. Well, so I think these aren't going away. I think the goal was we were going to continue to work through these, but if you guys want to discuss that now, then we can.
Oh, I was confused. I thought that whatever we accomplished today was going to be where our recommendations had to stand. I guess I might be confused.
No, I don't think. I guess maybe I misinterpreted it, but my understanding was as time allotted, we would continue to do this, but it does require us as a board to go over time typically.
If we're submitting the things that we're recommending as we agree upon them, it does maybe make sense to prioritize, maybe, but I don't know how time sensitive things are.
So these aren't submitted. So that's the thing. This isn't like a formal document that gets submitted to anything. This is recommendations that we discuss. And when we have opportunities to weigh in, we sort of have these pre-packaged recommendations that we can go to. And then we finalize that, and then we can send it either in a letter or a memo, or at council, we can speak to it. So this isn't a final document. So I think that's maybe where the confusion, this isn't anything that's being submitted to anyone at this point, other than for our record keeping and our records that like, this is what we've discussed and here's the recommendations. And some of these will be updated as more programs and more information comes from the bureaus.
Thank you so much for that extra explanation. I'm sorry that I was confused.
That's all right. Karen Williams.
Yes, thanks, Kaliska and Julia. And I think it is a little confusing, so no need to apologize. And I think the finality associated with today is this is probably the last time that this board has to confer on this topic. So if we wanted to have a list of, again, talking points, recommendations, that were being forwarded from this board, today's probably the last chance that we're all going to be able to talk about it, because we just have 2 more meetings in June, and they are pretty booked up with other important items as well. So I think that's what we were getting at and I can't remember exactly who said it, but the idea of voting on whatever recommendations we want to adopt today is going to be sort of the end of the fiscal, what it is, 2021, 22, I guess is what we're in. This board's recommendations on this topic. So, anyway, it would be great. So my opinion is it would be great if we could talk about number 35. If we do have a quorum that's willing to stick around for a few more minutes, I am. Because it might be the last chance that we as a board have a chance to talk about something like this. So that's it.
Go ahead, Tom.
I think since Karen is one of those people who's not going to be with us after this session, then I would really like to hear what she has to say about this number 35, and I would stay around to listen beyond the time.
Okay, so Karen, if you feel comfortable, did you want to kind of expound on what further discussion for this one?
Yeah, I don't believe I was the person who proposed this, but as I've started thinking about the amount of time and the effort it takes to do the outreach on the financial assistance programs, the fact that they are kind of ad hoc and sporadic in some ways and depending on other financial sources to be able to help through the pandemic. And then also reviewing the materials that were in the read ahead, that April report that talked about customers crying when they were able to get matching funds. That really had a deep emotional impact on me. because I know how it is when you can't pay your bills and you want to be able to do so. And it felt like the option of exploring some form of a tiered rate system based on income or other factors would be appropriate. And since it's just exploring the possibility, I do believe in possibility thinking leading to innovation. So I am definitely in favor of this.
Okay, thank you so much, Karen. All right, so I guess with that, again, these are just high-level recommendations and discussions and nothing as far as like final that's being sent, but is there anybody who, I guess, does not want to explore the possibility of a tiered rate system? Go ahead, Tom.
Oh, excuse me. I was just wanting to clarify from Karen. And Karen, are you talking about all the different charges, such as the base charge, the water charge, the sewer charge, the stormwater fee? In other words, all of them, explore all of them to see if we can get a better system, such as potentially a tiered system. Is that what you meant? All of them?
I hadn't even thought that deeply, Tom. So you should be on the committee whenever it comes up.
Okay, thanks.
Okay, so if there's not anybody, if there's anybody opposed, I just want to get there first. If there's any opposition, want to hear from them first. And if not, then I guess on these three that we were able to accomplish, I can't remember, Liza, we don't necessarily have to do we have to do a motion to approve these?
I think it would be good for closure for everybody on the board to take a quick vote to adopt those that were discussed today. And then that adds to the ones you've already adopted. And then the rest of it will just stand as a historical record should future boards want to pick up and continue that discussion. But you will then have some voted on adopted recommendations that everybody can use.
Okay, Karen Williams.
This is Karen Williams, and I will move that we adopt recommendation numbers. Oh boy, 20, is that what we started with?
Yeah.
Yeah, okay, 20, 21, and 35.
This is Tom. I will second that motion.
All right, and we'll go.
We also briefly, I think 24 might be somewhat on the table. Sorry to interrupt, just because there was an 8-1 on that one. Kaliska had mentioned.
Oh yeah, right.
That's a friendly amendment. Let's say.
Yeah, I think that was a no-brainer.
I
I think we should just stick with that. Yeah.
So I guess quickly, if there's no opposition, then we'll put 24 on the table. So we'll give 2 seconds. If there's any opposition, if not, then that will support is written as well. Okay.
I second the amended version.
Thanks, Tom. Okay, so quickly go through the vote. We'll start with you, Karen Williams.
I think we need to do a quick public call for public comment.
Oh, sorry. I always forget that. Yes, is there a public comments? Seeing none. Amy, Liza, if there's none in the chat. Okay, so we'll take it to the vote. Karen.
All right, Karen Williams, co-chair voting member, yes.
Kaliska Day, co-chair voting member, I vote yes.
Tom Lipton, voting member, I vote yes.
Karen Spencer, voting member, I vote yes.
Robin Castro, voting member, I vote yes.
Oh, Julia DeGraw, voting member, I vote yes too.
Teresa Huang, voting member, I vote yes.
Bill Turn, voting member, I vote yes.
This is Gabby, voting member, voting yes.
And I think that's everybody. All right. So motion passes and meeting adjourned. Just
Thank
want to give a
you.
special thanks to Julia and Sarah for that wonderful presentation. So thank you all. That was fantastic.
Thank you. We got a lot done.
Yeah.
Thank you.
Thank you, everybody.
See you in a couple of weeks.
Thank you, everybody.